I want you to remember that when things get too hot, tissue dries out and it scars. And we've talked a lot about enhancing blood flow, removing tissue waste, stimulating cellular rejuvenation. And if we don't go around this triangle evenly, scars can happen. And a scar is an example of tissue which was heated by inflammation. The tissue dried out, the cellular rejuvenation activities became disturbed, and the tissue turned to rawhide. Just like if you had wetted your baseball glove and left it out in direct sun for a number of days, that pigskin would turn to rawhide. And the same happens biologically inside your own body. So here's your summary shot of what to do for your home-based self-care to beat internal heat and external heat. Take a screenshot of this. We'll be posting this in the drtom.com/self-care video library. Avoid sun exposure, especially the hottest times of the day between noon and 3 p.m. Favor exercise in the shade or cooling activities like walking in the shade, walking in the forest, or water play. Wear lightweight, open weave clothing that can breathe. Take cooling baths and shower. Try some iced foot baths. Eat cooling foods. Drink more cooling nutritive beverages. Lay down during the hottest part of the day. Take a repose. Repose your spine from upright to horizontal during the hottest part of the day. And then feel free to spend some wakeful time underneath the stars and the moonlight when the temperature has dropped. Now, there's ways of lessening the total body load of heat or air pollution that has arisen by forest fires. And we do that with avoiding contaminated air, using masks, using inside filtration, and sometimes humidifying the air in order to get the particulate matter to fall out. And you can do that with a humidifier inside your house. You can do that with sprinklers outside the house. To breathe again, you want to open and close the pores of the lungs, the pores of your lungs. And we use both stimulants and sedatives, cooling sedatives to do this. It's like taking a warm bath, warm shower, then a cold shower, a warm shower and a cold shower, a warm shower and a cold shower, exercising the pores to open and close. You want to relax the nervous system of the lungs and the chest. The neck lymphatic massage that we've done so frequently at the beginning of the Zoom open clinic hours is a wonderful way to relax the nervous system of the lungs and the chest. You want to optimize the mucus viscosity. So the tissues that line the respiratory tract secrete a mucus or a mucin that's a little slimy. It's a lubricant. It traps air pollution. And you want to optimize that. And you do that by eating those cooling foods and beverages and nutritive beverages and maintaining the humidity in your local environment. You want to avoid paralyzing the cilia, the little hairs that brush air pollution out of the lungs, out of the respiratory tract. And the most common way of paralyzing those little hairs that brush and clean the respiratory tract is nicotine. So please avoid nicotine in order to ensure your health during hot weather. Now, some of you will get severe heat exposure. And in that case, oxygen and nebulized stimulants, what we call bronchodilators, can sometimes be necessary. Steroids, either nebulized, taken orally, or taken through injections may be required. And mucolytics, things that actually keep the viscosity of that mucin watery and runny, is very important. We do this by cool mist humidification or cool mist nebulization, either of water, salt water, or your old friend NAC, N-acetylcysteine. And this is, it's a little bit hard to get, especially for nebulization, even though it's an FDA approved drug specifically for nebulization, specifically as a mucolytic. Since the pandemic, it's kind of not so easily available except through compounding pharmacies. For milder ongoing care, ionized oxygen that we have available through the office has been used to deactivate what we call serotonin irritation syndrome. If you've ever felt the skin on the back of your neck standing up during Santa Ana winds, or had your kind of, skin get kind of creepy and irritable, we call that serotonin irritation syndrome. And it's very, very nicely salved, if you will, by ionized oxygen. And you can do that sitting underneath a waterfall. You can do that sitting underneath sprinklers. And we also do that in the office through different machinery that we have. Essential oils like peppermint can be inhaled or nebulized. And then take good care of your adrenal. I'm going to stop this right now and show you the peppermint oil that I keep right next to my desk at all times in the clinic. And it's very, very easy to use. This is a peppermint oil that we import from Germany. It's extremely high grade. And all you do is you just take off the cap and you put a couple of drops on the palm of your hand, rub the hands together, and you cup your hands around your nose and mouth, and you breathe in. And the oil evaporates off the heat of your hands. It's breathed in. It's a wonderful bronchodilator. Asthmatics oftentimes use this, especially when they don't have their rescue inhaler. It's a lot milder on the nervous system than rescue inhalers are. And it opens up the lungs, it opens up the sinuses, and it produces a very, very nice cooling effect on the body and on the mind. You can also take this and put a couple of drops of this into water and drink it. And it has a cooling effect on the stomach. It also has a cooling effect on the blood. Very, very affordable. And the name of it is just peppermint oil. And you can get that by dropping by the front desk, or you can email the front desk staff and ask them to ship you a bottle. It's a little bit. This is a third of a fluid ounce. I think it's under $20, and that will probably last you at least 5 or 6 months. All right, so without proper treatment of this heat, you are at risk of developing scarring in your lungs, scarring in other parts of your body. Again, take a screenshot of this if you didn't earlier. All the different things that you can do for your self-care to ensure that you don't overheat your body internally, externally. Take a screenshot of this and put it on your refrigerator, just so that as we go forward into this hottest season of the year, you're reminded about different things that you can do that will nourish your body and cool it down from the inside out. If you want to have more specific recipes, you can go to my cookbook and guidebook called Eat, Taste, Heal. It's available on Amazon. You can get signed copies through the office, but very, very available on Amazon. Eat, Taste, Heal, all 3 words. And these recipes are directly out of that book. Remember, human empathy. Empathy is a great cooler for people that have a lot of irritability, a lot of frustration. They may be acting out with rage. They may be angry. See if you can't cool yourself down first, and then be a cooling influence on those people as well.
Join Dr. Tom's Zoom Open Clinic Hour and get your health questions answered. Dr. Tom presents trusted health information and answers questions live every week. It's free to join. Just sign up at drtom.com/Zoom.